So there are now more than 2.5 million cases of COVID-19 globally, including more than 800,000 cases in the United States. Recall that we identified our first case of COVID-19 in New Hampshire about 6 or so weeks ago at the beginning of March. Since then, we have tested over 15,000 New Hampshire residents for COVID-19, including 225 that are currently undergoing testing in our public health laboratories. That's in addition to all the testing that is out there at hospital and commercial labs being undertaken. And to date, we have identified 1,491 residents of New Hampshire with COVID-19. Of these, 206 have required hospitalization at some point in their illness, and I'm thankful to say today I can announce that 0 new deaths have been reported compared to yesterday's numbers. Unfortunately, there are still 42 individuals who have died either directly from COVID-19 or from complications of COVID-19. And this is obviously the exact situation that we want to try and avoid. We have taken the steps we've taken at a community level to try and save lives, slow the spread of COVID-19, and prevent our healthcare system from becoming overwhelmed. I am thankful to say that our numbers remain relatively stable. We continue to see a plateau in the number of new cases being diagnosed and in the number of hospitalizations in terms of the daily hospital census of people every day that are hospitalized for COVID-19. Over the last approximately 2 weeks on a daily basis, there have been approximately 70 to 75 individuals hospitalized with COVID-19 throughout all of our hospitals in the state. This number has remained relatively stable. While our numbers have been stable, we have not yet seen a decline in the overall spread of COVID-19 in our communities. And so it's critically important for people to continue their social distancing efforts, to stay at home when able, to only go out for essential items like groceries or for medical needs. When people are out, we recommend that they wear a cloth face covering if they are in public settings where they cannot avoid close contact, such as in grocery stores. People should be practicing frequent hand hygiene, and certainly if someone is not feeling well or if they're sick, they should remain home. It's these social and physical distancing measures that are going to be the primary driver of controlling spread of COVID-19 in our community, given the widespread community transmission. And we hope to, at some point in the near future, see a decline in the numbers, indicating a decline in the community transmission in New Hampshire. But we will follow the numbers and the data very closely. We are working aggressively at the state level to try and increase testing, increase the capacity for testing to the extent possible given the supplies we have been receiving, including the personal protective equipment. We will continue to work to increase testing because this becomes critically important, especially when we start to open things back up in our society, to be able to move from a mitigation to a containment approach. You're seeing some of this play out, for example, in our nursing homes and long-term care facilities and assisted living facilities, where if there's an identified case, we're going in and testing much more aggressively to identify any and all transmission that might have occurred in these facilities. That is something we will continue to do to protect the older adults in our population and people with chronic medical conditions living in congregate living settings who are more vulnerable to spread of COVID-19 and complications of COVID-19. We will continue to work aggressively to protect these individuals and these populations. At the same time, we will continue to work to increase our testing capacity in New Hampshire. But for right now, again, we have not seen a steady decline or decrease in the community-wide transmission, and so it remains important for everybody to maintain the social and physical distancing that has been asked, to stay at home whenever possible. And I want to thank you all for your ongoing support and compliance with these asks, because it remains vitally important for our communities to protect those who are most vulnerable. Thank you.
Thank you, Dr. Chan. A variety of different issues that I'd like to just at least touch upon, and then, of course, as always, we can open it up for questions. One of the good news stories that we got yesterday and today, we know that there's a variety of charitable efforts going on across the state. The WMUR combining with iHeartRadio just last week to help the New Hampshire Food Bank that raised nearly $1 million, something like that, in just a few days. So they did a fantastic job. This combined with some of our efforts with the New Hampshire Charitable Foundation, with Granite United Way. We've had citizens and corporations donate money into both of those organizations. We got a summary yesterday that to date, from the Charitable Foundation, which is really our gateway to a lot of the smaller nonprofits across the state. They've already released nearly $4 million to about 400 organizations all across the state in a variety of different areas. Some are kind of really small, micro-local type nonprofits that help at a very localized level in our various communities, and some are a little bit larger, but that's a tremendous amount of effort, all driven off the COVID-19 epidemic. And again, I think it really highlights how much we come to rely on a lot of those different programs and services and nonprofits in our communities. So we can't thank the New Hampshire Charitable Foundation, all the citizens out there who have donated their money and their time to make sure that these organizations do maintain support. And again, we just want to encourage folks, whatever you can do on the nonprofit side. The Charitable Foundation is managing that. On the individual side, the ability to provide donations into the system and then make sure that it goes to individual families or families in need. Granite United Way has done a tremendous job as that as well. We want to keep making sure that people that can and have the means can keep giving in to those very worthwhile organizations. Second, we also wanted to provide an update on unemployment insurance claims. So yesterday alone, the state paid out over $50 million in unemployment claims, with much of that being attributed to these new $600 per week checks the federal government has been releasing. To date, over $88 million has been paid out across the state to approximately about 184,000 claims over the past few weeks. We now have over approximately 200 people in our call centers. We've made a very concerted effort to upgrade and enhance our ability to talk to folks one-on-one, walk through that process. The vast majority of claims have been approved for payment. There's a small percentage, 4 or 5%, that are still out there that require some more in-depth one-on-one effort, because those claims are just a little more complex. But I think the Department of Employment Security has done a great job over the past 4 or 5 days here, really trying to get their system up to speed and get folks the financial assistance that they need and deserve. We also heard that the federal PPP program, the Paycheck Protection Plan program, as of last week had kind of tapped out. It was a $350 billion program released by the federal government and managed by the federal government through our local banking system for small businesses to tap into loans for basically 8 weeks of paycheck protection so they could pay their employees over the next 8 weeks. With the numbers in, it looks like just over 11,000, about 11,500 businesses across the state were able to receive those loans totaling over $2 billion. So over $2 billion of loans being released to small businesses across the state, a very worthwhile effort and successful program. I was talking to members of the federal delegation last night and today, and it looks like now that they've reached a deal on another round of funding, similar to, and maybe even just an extension of the Paycheck Protection Program. Well, we're still waiting to see the details, so there will be more federal funds available to many of these businesses to retain jobs. It's tens of thousands of jobs that are being protected through this federal assistance, and that is definitely good news for the entirety of the New Hampshire economy. I believe it looks like this next round of funding, it's about a $450 billion bill that they're looking to move forward very quickly on. Includes some additional provisions, not just for PPP, but for testing and some other areas as well. I think hospitals as well. They're also, I think, appreciating the very large financial impact the COVID crisis is having on hospitals. So we obviously hope that bill will look at the details, but on its face, it looks like it's a good thing for New Hampshire, good thing to help people get them back on their feet and keep a lot of these very important resources moving forward in our state. We also want to address a lot of folks are talking about when do we reopen the economy. This is not an open-close situation. It just isn't, nor should it be. We've always said public health has to be preeminent, has to be one of the key factors that we are looking at when we take any steps. So we stepped in to a lot of the restrictions, that unprecedented restrictions, frankly, that we've had to put into place, and we're going to step out of it very, very carefully. So we're announcing today a task force. We call it the Governor's Economic Reopening Task Force. But what it's really going to do is bring in stakeholders and a legislative advisory piece as well that really looks at from a very micro level, all the different businesses and industries, whether you're a bowling alley or a movie theater, whether it's beaches or campgrounds, and really coming up with guidance documents that could potentially be used to allow a lot of these different organizations or private businesses, whatever it might be, to move forward in a sound and responsible manner with the input of public health, of course, figure out what the timing of that may be, where we are in this epidemic, assuming our numbers can go down, following some of the guidance that has come out of the federal government with a phased, stepwise approach, making sure that, again, we're not going to create a situation that allows a second or third surge of this virus to hit us. So we are starting to, we've over the past couple of weeks, we've been initiating some of those steps. We're formalizing it a little more this week. And again, what the timing of that might look like, it's still a bit unknown, to be sure. This is not something we're coming out of tomorrow or even next week, frankly. We're going to have to take a phased approach to this. Same with the stay-at-home order. We're looking at the different options for that stay-at-home order. Will it just continue as it currently is for an indefinite amount of time? No, we hope not. We may, again, take a phased approach, whether it's geographically or within different demographics of our population that we may have to keep that stay-at-home order in place for. And again, we'll try to give folks as much leeway and heads up as we can. We know that these restrictions are very dynamic in terms of their ability to freeze certain parts of our communities up, to freeze certain parts of our society up, and it's a huge sacrifice that everybody's making on the public and private sector, families, businesses. Everyone has given a lot here, but we're not coming out of it just yet. The numbers have stabilized, and that's a great sign, but we still have a ways to go. We've always known this could potentially be months, and again, I think by taking this very stepwise approach at a very granular level of understanding of how public health and safety can be maintained for all these different industries, I think that'll help keep New Hampshire on the right path. In closing, I want to bring up one other thing in closing, then we can take some questions. Tomorrow is CASA Appreciation Day. And CASA is an organization that I've been working with for quite some time. Marty Sink runs the organization there. Those are New Hampshire's court-appointed special advocates. These are the individuals that are on the front lines advocating for kids in very difficult home situations. They could be child abuse situations, domestic violence situations. It could just be situations on dealing with marital issues, whatever it might be. But these special advocates are trained all across the state. Tomorrow is the day that we really recognize them and show our appreciation for them. Marty Sink has been running the group over there, and her team do a great job. And frankly, I just wanted to put in a plug, given that it is that time of year. CASANH, CASANH.org. If folks are interested in getting involved, it's an incredibly, incredibly important group that does a lot on the front lines. And we know during tough economic times, I've had to create a special fund just to make sure that kids are being protected, to make sure we're ramping and amping up our prevention programs for children. And again, this isn't something that's going to go away next week. We're in a remote learning situation for the next month. We're then into the summer months. We don't know what options will be out there this summer, whether you talk about the Boys and Girls Clubs or the summer camps or those respites, if you will, for a lot of the kids that are out there. And so we need advocates fighting for these kids in very tough situations and tough times. And we just can't thank the folks at CASA enough, and we want to recognize them and encourage as many folks as we can to get involved with that organization. They continue to do great work for some of our most vulnerable kids in the entire state. With that, we can open it up for questions.
Are you still expecting a late April, early May surge in cases, or is this continued plateau an indicator that that is less likely?
I think it's less likely. I think that our efforts were frankly better than we expected, which is very good. But the efforts have to be kept up. Our good results are clearly a result of the very tough decisions we had to make, whether it's the stay-at-home order, only allowing essential businesses to remain open, et cetera, et cetera. So it could happen, of course, and we'll be prepared if it does. Whether you're talking about testing capacity, PPE, hospital beds, whatever it might be. But no, I mean, hopefully we're just kind of in this plateau right now, and that if we can start seeing some decline in numbers, that would be great. The fact of the matter is Boston is really skyrocketing right now. It really is, and that's a reality of Hillsborough and Rockingham counties in particular are effectively suburbs of greater suburbs of Boston, and we have to appreciate that. So we are, I don't want to say a victim of what's happening down there, but there is a direct relationship, of course, if you look at the number of cases in those counties with what's happening in Boston. I think Governor Baker continues to do a very good job fighting the good fight. They've had massive outbreaks. It's a very international town, right? We know a lot of these initial cases came over, whether it's because of conferences, the international travel, students, whatever it might be, a lot of asymptomatic transmissivity that potentially could have happened in those high-density areas, whether it be Boston or New York or otherwise. So, I was just on the phone with Governor Baker not an hour ago, and I'll continue to work with other governors as well. But that's it's something that we have to be very, very cognizant of, which is why when we talk about opening everything up and coming out of this, we have to be very stepwise, and we may take a regional approach with a lot of these efforts. We may allow certain parts of the state to free up and flex open, while other parts of the state we have to be a little more vigilant on, and that's just the unfortunate situation that we're in. If you look at New York, for example, I'm not sure how Governor Cuomo is going to handle it, but the issue in New York City is obviously very different than what they're seeing in upstate New York. I imagine other states may take regional approaches as well. You want to flex things open and give people that opportunity to get their economy and get their lives back in order and on a track as quick as they can. We all can appreciate that. But if you do it too fast and you do it without really looking at the data and the potential consequences of that, you could be not just right back in the same situation, but in a much worse situation. And then you would see that second surge or third surge potentially come.
So, Governor, Dr. Chen mentioned that the state's trying to move aggressively to increase testing. New Hampshire's rate of testing has been lower than some neighboring states. I believe it's about half of the rate of testing that goes on in Vermont. Why is that?
Well, I can't talk about the rates of testing in other states. I mean, obviously, a place like early on in Vermont, remember, they had twice the rate of infection that New Hampshire did because they had such a high influx of folks out of New York, and so they really ramped up their testing to be able to address that. Massachusetts is obviously dealing with a very serious issue there.
No matter how you look at it.
It is, but again, we're focusing our testing where it needs to be hit the most. So the fact that we're going to do 7,000 tests on our frontline healthcare workers in the areas that are most affected, for the long-term care workers especially in Hillsborough and Rockingham County. We have new tests coming on board. We haven't had, if you look at the Abbott test, for example, we've talked about this many times, we are absolutely limited by what the federal government will send us in terms of testing supplies. We're trying to get swabs in, we're trying to get assay tests and reagents in as fast as we can. I've been on the phone with the CEOs of some of these companies, pushing as hard as we can with Cepheid, with Thermo Fisher, whatever company can supply something. We're on the phone trying to get our fair share and make a strong push for it. We're using outside labs a lot more as well. We're going to be doing a lot of our testing out of the Broad Lab at MIT. The Mayo Clinic out in Michigan is doing a lot of testing. A lot of people are sending their tests out to LabCorp and other organizations like that. I think there was a little bit of a hesitation early on because some of the backlog in those outside labs was originally starting at 10 to 14 days. That was very preventative. But they've seemed to have staffed up or got themselves where they need to be so we can use them a little more often. So I don't want to talk directly about where other states are in their testing, but I can tell you we're trying to ramp up as fast as we possibly can, and we're scouring for materials and supplies as fast as we can.
One thing Governor Cuomo announced today was that parts of the state will have elective surgery in some of their hospitals. I know this is an issue you've been working on. Can you give us an update?
Sure. No, it's a great question on how fast we can get elective surgeries. I think I can tell you that we're going to try to get elective surgeries and other medical procedures up probably quicker than anything else because we can do it. Those facilities are set up to do it. We'll be talking to the hospitals later today and again tomorrow, trying to design a plan not just for each individual hospital, but also a statewide strategy in terms of how to do that and how to respond to it. So I think it's a great point, and it's a real need of the state. Hospitals have the PPE, they have the supplies. They know exactly how to scale back up. They're ready to go. We've talked to a lot of them already. They are ready to go. You have to understand that the bigger hospitals are a little different than the rural access hospital. So we just need to make sure that everybody is prepared. They know their role in the crisis and what the responsibilities and the opportunities that we can allow them to open up for would be.
So CMC announced 40% of its workers were being furloughed today, and they had applied for aid through the fund you created. They've yet to receive any. What's the process, and like what should people expect in terms of how those applications are handled?
Sure, you're talking about the hospital fund to backstop. Yeah, so we have, I think, a very good process. We have 5 or 6 individuals in the state. They have a ranking and a scoring system that every application comes in, they all get scored. We've prioritized those highest scores, which are effectively those most in need. And we've gotten money out the door, $30–40 million already, and we'll continue to do so as well. Places like, I'm not 100% sure about Catholic Medical in particular, but I can tell you there were a lot of hospitals that have already received tens of millions of dollars in federal funding. So that's good. The feds are stepping up and backstopping some of that. Their second piece of the $100 billion program is being released as well. And now it looks like even another federal assistance program is coming out specifically for hospitals. So we always are just ranking in terms of priorities and needs. We want to make sure that doors aren't being closed. When it comes to opening up elective procedures or additional kind of going back and opening up all the different other procedures that could come with a hospital, I think there's a huge opportunity there, whether it's Catholic Medical or Elliott or Dartmouth or whoever it might be, to get back on the right track financially.
Has the state's stance on mask wearing changed at all? Has that guidance changed at all? Or should people be wearing them when they're going out?
No, our fundamental stance hasn't changed. I don't know if Dr. Chan wants to elaborate.
Yeah, thanks for that question, and we certainly don't want to create confusion around what we're recommending. There was a document that we posted to our website, I believe it was yesterday, trying to clarify cloth mask use. We've been getting a lot of questions about how people should wear cloth masks, what we sometimes refer to as cloth face coverings. Sometimes they're not always true masks, so to speak. Getting questions about how to wash masks, how to care for them, and what situations people can and should wear cloth face masks. And so we created some guidance that we put on our website, and it was drawing both from the Centers for Disease Control and Prevention guidance. We were also drawing from another state's public health guidance. Sometimes public health agencies do this. We see something we like or some format we like, we draw on it from other state public health jurisdictions, and so created this guidance document. Our stance on cloth mask use remains the same, which is if someone is leaving their home and they're going out into a public setting where social distancing may be difficult, we absolutely recommend people wear a cloth face mask or a cloth face covering. If someone is going outside of their house and going for a walk by themselves or with people from their household, there's not a need to wear a cloth face mask because they won't be in contact or close contact with other members of the public. So the times when people absolutely should consider wearing a cloth face mask are when they are out in public places, for example, at a grocery store, in social distancing, maintaining that at least 6 feet of safe distance is going to be difficult. That's not certainly a requirement of anybody, but we certainly recommend that people do that. And I think that we're already seeing, and there's much more discussion going on about wearing cloth face masks, and again to protect other people. The purpose of a cloth face mask, this is the other thing that we try and clarify in some of this guidance that we put out, is that a cloth face mask is not meant as personal protective equipment, right? It's not meant primarily to protect the person wearing the cloth face mask. It's meant to protect other people in the event that someone is going out in public and might be starting to shed virus from their respiratory tract and may not yet have symptoms, given what we knew about this virus.
So Dr. Chen, for a couple of weeks the state has indicated that more data was coming on ethnic breakdowns of people infected. Is that going to come?
Yes, that should come, I believe, probably as early as today. We are updating daily numbers on our New Hampshire government COVID-19 website, but we're also posting a weekly numbers summary, what we call an EPI summary. The new update this week should include that information on race and ethnicity for the individuals we have it on. The data is not 100% complete, but for those individuals that we have data about race and ethnicity, that will be published in this week's report.
Doctor, can you describe kind of triangulate for us where we are now in the calendar versus the implementation of certain measures and when we should start to see maybe a full effect of more people staying home? Can you give us kind of in that timeline back and forth there?
Yes, the question is where we are in the timeline of implementation of measures, and I don't have all the dates from when we have implemented stuff in the forefront of my mind, but certainly over the last 6 weeks or so since we've identified our first cases of COVID-19, there have been multiple measures put into place, including a stay-at-home order, I think upwards of a few weeks ago now. Typically with every step or every intervention, it can take 2 to 3 weeks, upwards of 3 weeks to be able to see the full effect of that. And so I think what we've seen in the plateau in terms of the number of cases, the hospitalizations, is a reflection of those measures that we've taken before. I think that the primary way that we are going to get these numbers to go down, which is an indication of community transmission going down, right? That's the ultimate goal, is to get community transmission down, is by maintaining the social distancing measures that have already been put in place.
Massachusetts is going to be implementing contact tracing technology soon. Given our proximity to the greater Boston area, is that something we're considering here?
So the question is about contact tracing, and specifically questions about technology, or
Right.
contact tracing in general?
The technology, people can download an app in Massachusetts soon to,
Yeah.
you probably
Yeah.
know.
So to clarify a couple points of that, we have been doing contact tracing all along, ever since we've identified our first cases here in New Hampshire. That's been something that our public health team, the dozens of epidemiologists and public health nurses and support staff have been conducting those investigations on every single person diagnosed with COVID-19. We will absolutely continue that work going forward. We have no plans of stopping that. Other states, because of the overwhelming number of cases that they have received, have not been able to conduct contact tracings on everybody, but there's a recognized need that needs to happen going forward. New Hampshire has been in the position of always being able to conduct those investigations, and we will continue to do so. Part of what's being discussed, not only in New Hampshire, but in other states and actually at a national level, is there certain technology, phone apps, which can help facilitate that process. These are informatics technologies that we are looking into along with other states. In fact, there's help at a national level to do this through organizations like CSTE, that's the Council of State and Territorial Epidemiologists, and the Centers for Disease Control and Prevention. These are federal agencies that are helping us look into these different technologies. But these technologies are meant to support the core public health work conducted by people, public health professionals, that is already and continues to occur in New Hampshire.
Governor, you got a lot of schools who opted for no April vacation. Do you have a message for parents who are just saying they could really use a break right about now?
So I'm laughing because the question's about parents that could, for school districts that did not opt with April vacation, and a lot of parents would like a break, and I can tell you my wife and our family is probably one of them as well. It's a lot to ask for parents on this remote learning. Again, just speaking, take my governor's hat off for a minute and just talk as a dad. I have an 8th grader, my son's in a freshman in high school, and I got a 1st grader. So we are running the gamut of literally running around the house trying to make sure that you have, whether it's the technology available, sharing of computers and all that. It's hard. It's really hard. If districts have chosen not to do April vacation, I can appreciate that. They probably want to kind of get the school year done. They're in a mode. They want to keep up with their momentum. If parents are having trouble, contact the district, contact your teachers. What we have found, not just in our family, but I think in most districts, and what we very much encourage from a state level, is flexibility. A lot of flexibility, whether it's in grading, allowing students to continue on. We're encouraging the pass-fail option for a lot of districts. So, and we find that most districts are very open-minded about if a parent is struggling or having trouble or a student needs a little more extra time, just talking to the teachers and talking to the district usually yields a lot of very positive results. But I can empathize, sympathize, and my family can absolutely relate to a lot of folks who have struggled a little bit through remote learning. But again, hats off to our system. We've done it better than everybody else. You have a lot of other states out there that are just shutting down school for the rest of the year, and that's going to create a lot of gaps down the road. I'll have some discretionary funds at my availability come August and September, specifically for education, and I'm holding on to those funds because we're going to need the summer to identify a lot of the potential gaps in the system, gaps with special ed, gaps with additional programs programming so these students can hit the ground running as fast as they possibly can in September, knowing that the end of the school year was very rough and didn't necessarily provide a seamless transition into the next year. And the sacrifices that our students have made have been huge. I still hear, I personally know seniors who aren't graduating or going to prom, or even being able to say goodbye to their friends in a concerted way at the end of the year. Think about that. You're in school with your friends and counterparts for 12 years, and at the very big end, you don't even get to say goodbye. And that's tough. It sounds trivial, but it's not. It's a very big deal. And so, again, I guess it's our giant apology for the inconvenience, but we're dealing with a worldwide pandemic, and unfortunately, everyone has to make a lot of very tough changes and sacrifices at this point.
Governor, a massive amount of PPE has made it into the state with these two big shipments that we've seen over the last few weekends. How much of that has gone out the door? And in context, how much of the need does that meet? Because we saw an email coming from Dartmouth-Hitchcock today saying, fundraising, saying, hey, we need money, we need help getting PPE. So versus the need, how much of that is that going to meet?
So a couple things. A massive amount of PPE has come into our state, specifically around masks and gloves and a few other items. Face shields, we have a lot of face shields. We're still trying to meet our need on gowns and things of that nature. Gowns are actually very hard to come by right now. We've done okay, but we can always get some more. No one has run out of masks or anything like that, and as there's a need, we put it out. So every day I get a list of anywhere between 80 and a couple hundred different organizations that we're sending our PPE out to. I get a very specific list, and it goes out, whether it's N95 masks or surgical masks, whatever it might be. So on that front, I think we're definitely meeting the need. We're making sure nobody goes without. I think we're expanding our ability to be able to put it, whether it's into the private sector or help organizations that are on the front lines. We've said that any state worker, for example, that wants that feels comfortable and wants PPE can get PPE if that's how they feel comfortable. A lot of our state workers are working from home right now, so that's understandable. But also a lot of are on the front lines. Maybe you're a DCYF worker or working in social services. Maybe you're on the, working at the liquor store or something like that, or coming, in direct contact with the general population and citizens. Whatever people need to feel comfortable, we're going to be there for them. We're going to keep bringing more in. We already have other shipments planned and scheduled. We'll probably bring some pretty sizable shipments in this week and next week. And my sense is we're going to keep this up for the next few months at least, because it's the type of thing where you really can never have enough. And so we continue to scour not just here within the state. We have other manufacturers that are starting to make our own, which is great, across the country and across the world. And we've put ourselves in a very good position. I think we're getting New Hampshire is getting a reputation for a place that can do deals very quickly, and get stuff done and organize it from a transportation, logistics, as well as an implementation facilitator. And so that's allowed us in this kind of wild west of trying to grab PPE across the planet. We're kind of leading the charge with a lot of other states, and we've been able to share a lot of our PPE with other states as well.
You've gotten some requests when it comes to campgrounds on all sides, right? Some want them open, some want them closed. Could you talk a little bit about that buy plan? I guess how soon you need to kind of pull the trigger on whether to keep them open or not?
Every day is an amazing challenge with this crisis, and you never know what is going to be the issue of the day. Well, the issue of the week is really campgrounds. And it's one of those things you don't think that it's a major issue, but it really is. It's a very significant issue. And just to take a step back, I think the biggest concerns we're hearing are from those communities and businesses in those communities where there are campgrounds that, frankly, just don't want people from Massachusetts in their town. Just to cut right to the chase. They don't want folks in a very, very highly affected area of Massachusetts to be coming up, using their campgrounds, and potentially spreading the virus. And that's a very real concern. It really is. So we're going to create some guidance. We're going to try to keep them open. We may have to close them. We absolutely may have to do that. But we've talked to a lot of the campground owners, the towns that are involved, those that have concerns, and we've crafted a guidance document that we're trying to kind of shop around a little bit and see if this is something that could work. If folks don't feel comfortable and it's not going to work, then I'm not above having to close them, but we're trying to make it work for individuals and keep things in a box such that we can give folks confidence that by keeping them open, we're not going to be spreading the virus in any different way than it potentially is. And especially in areas of the state that, when you're looking at Carroll County, Grafton, Coos, that don't have incredibly high infection rates right now, it's very understandable. They want to make sure that doesn't come in and spread throughout their community. It's not what happens within the campgrounds. We can control that very well. It's just the matter of who's going to be using them. Same with hotels. We obviously want to get our hotels up and running. We want to get restaurants up and running. We could have a whole new guidance document that absolutely protects the wait staff, the customers, ensures no viral spread in the restaurants. But you can imagine what's going to happen when Salem, Nashua, Hudson, and Hampton open up restaurants, even under new guidance. Everyone from Massachusetts is going to potentially run over the border. So that's a real concern, and so we have to find ways to mitigate that, manage that, and give both the public and the communities, and the folks visiting those establishments the security that it can be managed. It's a real challenge. It is.
So, Governor, what is your sense of the implementation on, I'm forgetting what you called it, but the supplemental pay for people who work, frontline workers in nursing homes,
Yes.
where Medicaid is involved? I've talked to some people at homes where there seems to be some confusion over whether anyone who's a frontline worker at a home that has some portion of its clientele funded by Medicaid gets money, or whether it's apportioned in a more complicated way.
No, I think it's a pretty simple, straightforward formula. If you are taking Medicaid patients, if you're a provider of long-term care or residential support services, and you work in the Medicaid field, then you can apply for funds for your staff to be supplemented. Traditionally, a lot of those organizations don't get paid as much. Those rates are simply lower than what you typically find in the private sector. They're putting themselves on the front line, so that was the first place we wanted to go, to make sure we were providing that financial incentive to keep the workforce where it needed to be for some of our most vulnerable populations. Doesn't mean we're going to stop there by any means. That was kind of our first draw. We may, and we're already looking at options for other frontline workers, and that's a very broad definition, but it could be anything from police, fire, and EMTs. It could be folks that are working in private long-term care facilities, folks that are working in hospitals or nursing facilities. There's so many different aspects. Additional folks that might do residential care, but on the private side, not on the Medicaid side. We could probably find some opportunities for them as well. But we're looking at where that workforce need really is, making sure they have, remember, that's just one piece. Pay is just a piece of the puzzle. It's PPE, it's testing, it's pay, it's a couple different things to make sure we're incentivizing those and protecting those folks that are doing that kind of work. So there's a variety of options still on the table for all the other organizations. But if your organization is taking Medicaid residents right now, then you should be able to apply. And 100%, one of the fundamental differences with New Hampshire's program from every other state is that we're doing it now. We're not waiting for our federal approval. We are doing it now and today, and I think we're one of the only states to do that, very innovative. And B, all the money goes to the frontline workers. There's no skimming off the top, if you will, of administrative fees or anything like that. Every dollar that goes into those organizations travels directly into the pockets of the frontline workers. So we've just tried to streamline the process that way. I'll take one more here, and then we're going to do some phone calls.
Really quick, can you just clarify, we're within the 2-week window now before the stay-at-home order, the May 4th?
Yes.
So can you just give us, I know you talked about it earlier, but can you clarify on your timeline when we will likely hear what you're going to do in terms of this flex, or what's going to happen? So
I think by the end of the week we'll have a better sense. Again, we're engaging with stakeholders. We're talking to the legislature, primarily because they're the legislative advisory group that's part of this, helping try to open New Hampshire stakeholder group is talking to a lot of their constituents about their concerns. We're talking to border towns and northern towns. We'll be able to, I think, have some recommendations either by the end of this week or early next week about where we want to go specifically with the stay-at-home order, as well as probably a variety of other, public and private sector organizations, whether it be restaurant, hotels, hospitals. We'll do some on the phone right now, if we could.
The next question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thank you. Looking again at the nursing home outbreaks, are there cases where a lack of available testing or delays in testing have contributed to those outbreaks, or conversely, have you seen cases where testing has helped nursing homes avoid wider problems?
I don't think there's any case of a lack of testing causing an outbreak to be worse than it potentially could be. The more testing you can do, the better. One of the things that testing is really about making sure that if there is an individual or a couple individuals that may have COVID, that you can isolate them fairly quickly. So one of the other issues that we're having and we're finding, and some of the initial results of the Convenient MD testing will start becoming available as early as today, tomorrow, in the next day or so. Some of those initial cases from the frontline workers in long-term care facilities, and we're testing all of them in Rockingham and Hillsborough County. Some of those initial results will come back, but what we've already seen in previous testing is that you have a lot of asymptomatic cases, to be sure, and the potential for asymptomatic transmissivity, not just amongst the workforce, but amongst the residents, can be very high. So again, we're going to keep pushing to open up our testing as much as we possibly can, keep pushing the federal government to provide a lot of the resources that are required for some of these more specialized devices, and really start pushing some of our commercial providers to try to get ourselves a little further along in the line. Right now we're behind the Massachusetts and New Jerseys and New Yorks and Californias of the world. You already see spikes in other parts of the country that are kind of, I don't want to say jumping us in line, but they are starting to take more of a priority. South Dakota, California has a bit of a resurgence of some of their numbers coming back. Some states have seen this kind of second wave start to hit them a little bit. So we'll keep pushing. I mean, the fact that we've been able to mitigate our viral spread is a very good thing, but unfortunately it means that we don't always get preferential treatment here within the U.S. on terms of the actual testing materials.
The next question comes from Nancy West with In-Depth. Nancy, go ahead with your question.
Nancy, hello? Are you muted, maybe? Well, maybe we go to someone else. Maybe we get Nancy back on the line.
The next question comes from Michael Graham with Inside Sources. Michael, go ahead with your question.
Michael, you on the line?
Michael?
All right, we'll come back to you.
Next question comes from Tim Camarado with the Valley News. Tim, go ahead with your question.
Does the system look like it's working okay? We'll check on the technology of the system. We'll come back. Yeah, sure.
Dr. Chan, I'm curious about this report in the LA Times coming out of, I believe USC did a study that indicated that an antibody test in Los Angeles County that indicated that far more people in California might have had coronavirus than they initially estimated. A, are you familiar with this report? B, what's your read on it?
Yeah, so questions about the report, I think it was done in California, you mentioned, looking at the true prevalence of COVID-19 based on antibody tests. And, you know, this is one of the primary purposes right now of trying to acquire an antibody-based test. These tests, there's dozens, if not, you know, over 100 tests, different manufacturers out there that have started to develop these tests. The unfortunate reality is that many of these tests, we're still understanding how good they are, essentially, how accurate they are. As with any type of test, we need to better understand what we call the test characteristics. There's always a possibility of false positives, so someone having antibodies detected when maybe they're not truly there, or false negatives, maybe the test isn't sensitive enough to pick up antibodies when somebody has truly been exposed. So this is an active area of investigation to figure out how accurate and how to use these tests. They're not ready for individual medical use in terms of, you know, helping to inform someone's medical care. The tests aren't accurate enough yet and haven't been studied enough. But one of the things that health departments around the country are starting to look at is how we can use these to better assess exposure within a population. So these are tests that are out there. They're coming. The CDC is working with some states, such as New York and other states, to begin to investigate some of these tests and get some better sense of true population levels of exposure. So there's going to be more information coming about these.
Doing okay?
Yep.
Okay.
Nancy West from In-Depth, go ahead with your question.
Thank you. Can you hear me?
Yes. How are you, Nancy?
Hi, thank you. I'm fine. Thank you, Governor. I was wondering if you could tell us who you're going to appoint to the reopening committee, the economic task force.
So we'll put there is a guidance document. Everything is about a guidance document, but I guess it is a task force document that's going to be released today that has all the names on it, and we'll be sure we get a copy to everybody. But it's stakeholders. Right? What we tried to do is find folks in the restaurant industry or in the hospitality industry, in manufacturing, in construction, in tourism, really cover a variety of bases, as well as some folks in the legislature that offered to participate, which I think is terrific. So we'll make sure everyone gets a copy of it later today.
Yes, Governor, will those meetings be public? And I also have a question about the meetings in general. You get very little lead time on them, and I'm wondering if there's one place the public can go where they can find out what the call-in numbers are and when the meetings are going to be held.
So we follow the 91A regulations for all the meetings, which means we notice them at least 24 hours in advance. The task force and the meetings for all these different groups are all different. They're all managed a little differently. Some are out of Business and Economic Affairs. The Gopher Committee does theirs. So, but they are all noticed with 24-hour advance notice. So, and sometimes they may spring up because some stakeholders or someone calls in and says, hey, would really like to approach this and have a public discussion about that. And I think they're trying to simply accommodate being extremely transparent. One thing we've insisted on this entire process is everything has to be very, very transparent. That allows us to, again, ensure the public trust, the public knows where we are, and that ensures our ability to move very, very quickly as well. So, again, we do notice them with 24 hours notice, and I would just keep checking in with those sites to see what might be available.
Michael Graham from Inside Sources, go ahead with your question.
Another study that came out today from the CDC, hope you hear me, yeah. Another study that came out from the CDC today found that 9 out of 10 of the hospitalized patients they looked at had some other condition like obesity, hypertension, etc. And they listed the release of comorbidities. Speaking of transparency, that we can get more information about the comorbidities of the people who've been hospitalized in New Hampshire. But the data we have on them has people asking this question. With 90% of the fatalities being people over 60 plus, most of them with comorbidities, 70% of the hospitalizations the same, all of them with comorbidities. So real problems, a specific set, 15% of the and why couldn't the state move forward with a that puts the burden for quarantine, et cetera, on those people and frees up other people to get back to work, generate revenue? That's a question we get a lot.
Sure. So the question revolves around the unfortunate fact that with a lot of the mortality and hospitalizations we see, it isn't just direct COVID related. It's COVID usually attached to some other extenuating healthcare issue. It could be diabetes, it could be hypertension, it could be a respiratory issue, whatever it might be. And we've always known that COVID gets exacerbated with all these additional healthcare issues, and that is the vast majority of fatalities and hospitalizations that we have seen in the state. So the question really is, as we go forward, is there an opportunity to segregate that population with the stay-at-home order and create different dynamics that might work for either a younger or healthier population versus the older population and those with other potential comorbidity health issues that might exacerbate the COVID problem and ultimately the mortality rate? The answer is absolutely. We can definitely look at that, and we are looking at that. We're looking at all the data that would surround that, how it might look, what you do geographically, what you do within those segregated populations, and how to manage it. It is not as simple as, well, just go do it, because you really need to look at the data and look at the issues and figure out not just how to do it, but how to manage it, how to create accountability around it. And those are all things that we're considering at this time.
Tim Camarado with Valley News, please go ahead with your question.
Construction projects. Governor, I've been hearing that construction projects in New Hampshire, municipal and state construction projects, are being delayed because of Vermont's stay-at-home order, and that prohibiting contractors from Vermont from coming and working in New Hampshire and then returning home. I guess, are you aware of these limitations, and is this something that your office is doing something about or working on?
So the question revolves around construction projects that may be delayed given Vermont's tighter restrictions around manufacturing and, more importantly, construction. And if folks are using contractors out of Vermont, yes, we absolutely know about it. We've heard about a lot of these individual projects. And yes, if you're using contractors out of Vermont, chances are your projects are delayed in some facet. In terms of what we can do about it, I've talked to Governor Scott about it. But again, he's got to make decisions for his state like I have to make decisions for mine. We've talked about some of the flexibility that might be possible, but Governor Scott has to make tough decisions for his state, just like New Hampshire does as well. It's unfortunate, but would like to see those projects move forward as best we can. But right now, he's making decisions in terms of holding back a little bit on the construction side of things, given a variety of different variables. His variables are similar to mine in terms of the variables, but his dynamics are different. He's closer to New York City. He's has different demographics within his different industries that he works with. So, he has to make some tough decisions. We're aware of it. There's not a whole lot we can do. Again, my sense is over the next few weeks, there'll be some flexibility provided by a variety of states in New England, and I'm working with him and Governor Mills especially in Maine very, very closely in terms of making sure we're all relatively on the same page as we potentially open things up. Okay, we're good with stuff on the phone. Anything else here? Anyone have a birthday? Does anyone need a birthday card? I got a lot of requests in, that's for sure. I think 1,000 people requested a birthday card 2 days after I put that one out on social media. So happy to do it. I was up late last night writing a lot of birthday cards. We'll be up again. Thank you, everybody. Look, there's always new information. There's always something going on. This is a very rapidly moving situation. We appreciate everybody's patience. We're not on the downswing yet, but we have a lot of data to work with. We're going to keep expanding testing, PPE access. The federal government will hopefully keep providing some financial opportunity for New Hampshire, and we'll keep trying to operationalize that and make it as simple and streamlined as a process as we can for our families and our businesses as we work through this crisis. So we thank everyone again for their patience, for their diligence and vigilance, if I may, about staying right on top of this stuff. It's a huge sacrifice by everybody. We're going to get through it together. Thank you, guys.